Hello everyone. Today I'm going to talk about Cushing syndrome. Cushing syndrome is a clinical state produced by chronic glucocorticoid excess and loss of the normal feedback mechanisms of the hypothalamic pituitary adrenal axis, the glucocorticoid axis, and there is loss of circadian rhythm of cortisol secretion, which is normally highest on waking. You should at this point understand the normal physiology of the glucocorticoid pathway. So, normally, the hypothalamus secretes corticotropin releasing factor, CRF, which stimulates the pituitary gland positively to secrete adrenocorticotropic hormone, ACTH. ACTH then acts positively on the adrenal cortex to stimulate cortisol and androgen secretion. The cortisol then has negative feedback on the hypothalamus and pituitary gland. This is the glucocorticoid axis to regulate cortisol secretion. So to summarize, in Cushing syndrome, there's excess cortisol. So what are the causes of Cushing syndrome? I've divided them into ACTH-dependent causes, where there are high levels of ACTH causing increased cortisol production at the adrenal glands, and ACTH-independent causes, where there is actually reduced levels of ACTH because of negative feedback by the cortisol. The first ACTH-dependent cause is Cushing's disease, which at this point I should highlight is different from Cushing syndrome. Remember, Cushing syndrome is a clinical state. Cushing's disease can be a cause of this clinical state. It is bilateral adrenal hyperplasia because of an ACTH secreting pituitary adenoma. Next, ectopic ACTH production. Ectopic ACTH production can cause Cushing syndrome. This is the production of ACTH elsewhere in the body other than from the pituitary gland to stimulate cortisol production, such as by small cell lung cancer. So the secretion of ACTH by small cell lung cancer is not regulated by negative feedback, and so ACTH continues to be produced, continuing to stimulate cortisol production from the adrenal glands, causing Cushing syndrome. Then, moving on to the ACTH-independent causes. There's adrenal adenoma, adrenal nodular hyperplasia, and most commonly, iatrogenic causes. So for example, patients taking oral steroids as medication for another illness. I hope this has been useful to understand the causes of Cushing syndrome. Thank you.